Hello, my name is David Hoffman. A little background about myself. I am doing my poster project on obesity screenings. I am a student in the Master of Science Nursing program, the Family Nurse Practitioner program. The background about myself is I have actually been obese in the past. I have lost over 100 pounds, so obesity is it's a concern to me as it involves the healthcare setting. So I want to do my research on obesity itself. So my project is going to be examining the rate of obesity screenings in a primary care clinic comparative to the national average. This was done in a primary care clinic in the area. Purpose of it, the introduction to it, the obesity, it's a global pandemic. The rates of obesity have nearly tripled since 1975 over roughly a 40 to 50 year period. With this creates a lot of healthcare related cost. They've increased 187% between 1998 and 2008. This trend continues to increase. In the year 2018, 31.3% of Americans were obese. This is obesity considering a BMI or over 30. Preventive medicine is coming to the forefront of healthcare, and this is one of the trends to prevent obesity, in my opinion. So, one of the first things you do to prevent in preventive medicine is recognizing the problem. Preventive medicine is showing great promise in combating the pandemic. A goal was set by the Healthy People 2020 initiative for 53.6% of patients in the family care setting to be screened for obesity. This is the national average we're going to be comparing the rural clinic with. The purpose with my research is to discover the incidence of primary care providers in a rural Arkansas clinic who regularly assess BMI in their adult patients compared with this Healthy People 2020 initiative. The objective was to ascertain the rate of obesity screenings in this local clinic and compare that with the national average again. The methods I used to get this, the IRB was obtained through Arkansas State University. It was a retrospective chart study. The data I gathered for this chart study was between the months of January 1, 2019 and June 30 of 2019. Through this time, 2,239 patient charts were reviewed via the clinic's electronic health record. That's the data collection tool that was used. The population of the patients were, again, 2,239 for the total number. All patients seen over the age of 18. We excluded anyone under the age of 18. We included, again, all over 18, male, female, irrespective of race. The findings of the study was, per their EHR, which is, again, their electronic health record, 93.08% of the patients that were seen in the clinic through those 6 months were adequately screened for both overweight and obesity per their BMI. So the discussion around this, there's many barriers to BMI screenings in the past, but EHRs and EMRs are becoming widely used. And with the introduction of these in the clinic setting, I do feel that the Healthy People 2020 initiative will be met as it was met in this rural clinic. Using this data, we can ascertain an increasing ability in not only screening for patients for obesity, but also educating and treating for the disease itself. Again, screening and recognizing the problem is the first step to treating this problem and getting ahead of this problem. The references I used for this particular slide are the Healthy People 2020 initiative, which is the NWS 5-1 initiative for 2019, the World Health Organization, obesity and overweight article from their online database, and the United Health Foundation, obesity in Arkansas in 2018 information. I would like to acknowledge in this the Family Practice Clinic of Paragould, Arkansas, specifically Ronette Wise, nurse practitioner, my preceptor, and Ginger Hyde, the office manager. I'd also like to recognize Dr. Chris Jordan, who is my faculty advisor in this, and Dr. Savannah Coyne, which is my clinical instructor throughout my clinicals. I hope you enjoy the presentation. Thank you very much.